Hello, this is JGlaenzer, and this is my history and physical video for course 612. This is my patient, 45-year-old male. Before he came to the exam area, I had him empty his bladder and put on some comfortable clothes. He was dressed in clothing appropriate for the time of year and the weather. I also got his height and weight and his vital signs. I'm going to start with your head. It's a head to toe assessment. First, inspecting the head, your skull, looking for any unusual lesions, scabs, burns. And next, I'll start with palpation. Also looking for any sparse areas in the hair. And please let me know if anything is painful or hurts. Looking from the frontal to the occipital area. Next, I'm going to ask, can you wrinkle your forehead for me? Alright. I'd like to do a test light sensation, and you just let me know if you feel this the same or different on
Same
each
on both
side.
sides.
Thank you. And here?
Same on both sides.
Okay. And here?
Same on both sides.
Okay. The next thing that I'd like to do is palpate his forehead, palpating the frontal sinuses, his maxillary sinuses, facial bones. Can you open and close your jaw for me? His temporal mandibular joint, looking for crepitus and jaw popping. Alright. The next thing, I'm going to just put on a glove and palpate his eye area here, the lacrimal apparatus. Looking for any tenderness or swelling areas there. Also, can you look up for me? Okay, and now this side. I'm looking, his sclera is white and the conjunctiva is pink and moist. And you can look down now. Can you close your eyes for me? And then his eyes are completely closed. The eyelashes are outward, away from the globe. Can you open your eyes? And his eyes are open fully without ptosis. Next thing that I'd like to do is a vision test. This is a Rosenbaum pocket screener. Can you cover one eye and just let me know what the most comfortable bottom line reads?
937856.
Okay. And let's cover the other eye. And if you can do
935876.
Okay. And according to this chart, that is 20/20 vision, so you have good vision. Next is going to be something called the cover-uncover test. So I'm going to cover one eye and ask you to have a fixed point on the wall. And I'm going to cover one eye and I'm going to look at your eye, your pupil reactions here. Okay. Okay, excellent. The next thing I'm going to do is the 6 fields of gaze test. So I'm going to ask you to follow my finger, and I'm going to make the shape of an H. And actually right here, I'm checking for your extraocular muscle movements. Okay, excellent. Next thing I'm going to do is have you test your peripheral vision. I'm going to have you cover your left or right. You choose first. Okay, and I'm going to cover mine. And I'm going to ask you to let me know when you first see my finger coming into your field of vision.
I see it now.
Okay. And let's check the other eye.
I see it now.
Okay, excellent. That sounds good. That's what we want, healthy eyes. The next thing that we're going to do, let's go ahead and do the your ears, your auricles. Test your hearing. This is a tuning fork, and I'm going to strike it, and I'm going to have you, I'm going to put it on your forehead, and you let me know if you can hear it in both ears equally.
I can hear it both equally.
Okay, thank you. And the next thing that I'm going to do is with the tuning fork as well, I'm going to put it on your mastoid bone and then in front of your ear. And you let me know after that first point when I ask you, let me know when you can no longer hear it. And at that point, then I'll put it in front of your ear.
Okay.
All right. And I'm timing him.
I can't hear it. I can no longer hear it now.
Okay. And that was about twice as long from the hearing it through the air as through your bone. And let's try the other ear.
I can no longer hear it.
Okay.
I can no longer hear it.
Okay, and once again, that's about twice as long. So your hearing is good. Let's do another hearing test. This is going to be called the whisper test. If you can cover your hand, cover your ear with that hand, and I am going to whisper to you.
1, 2, 3.
All right, so you can hear well in that. And do the same for the other ear. And let me.
4, 5, 6.
Okay, excellent. That sounds good. So your hearing is pretty good. I'd like to go ahead and do more to your ears, your hearing. I'm going to use the otoscope here and look at the inner ear. I'm going to look at your inner membrane here. Inner canal, I'm sorry, this is called your tympanic membrane. And I'm looking in here, and I'm seeing that it's gray, pearly gray, translucent, no perforation. And let's look in the other ear. And pearly gray with no perforation. Okay. The next thing that I need to do is look at your nose. Looking at the outer part of your nose. It's in line, midline. And I'm going to ask you just to continue to breathe normally. Okay. Making sure that each nair is breathing normally without any extra noise or anything of that nature, and it is. Next thing I'm going to do is go ahead and look inside the nose. If you can tilt your head back a little bit. And I'm looking at his middle and inferior turbinates and the septum. Oops, things coming off. And let's do the same for the other nostril. And inferior and the septum. I want that to come off. Okay, thank you. And your nose is fine. Next thing I'm going to do is the mouth. Can you smile real big for me? Okay, and can you blow out your cheeks with air? Excellent. And if you want, can you open your mouth for me real wide? I'm going to look inside. And looking at your buccal mucosa, and looking at your soft palate and your hard palate, looking at your teeth. Let me get a tongue depressor here. Can you say ah? Ah. Okay. And looking at your uvula at midline, your tonsils, the tonsillar bridges. What else do I see? I see the dorsal part of your tongue, your ventral part of your tongue, and the teeth are tight, and I don't see any missing or holes or any odors from your mouth. And we're going to test your gag reflex. Okay, sorry about that.
That's okay.
Not fun at all. Okay, do you have any questions up to this point?
I don't know.
Okay, so the next thing that I'm going to have you do is, let's see, do the mouth. So let's have you, can you stick your tongue out for me? And can you turn your tongue to the left and right? and then up and down. Okay, excellent. All right, the next thing that I'm going to do is look at your nodes, your lymph nodes. You've got a lot of lymph nodes. So first thing I'm going to do is your pre-auricle nodes, just feeling for them on either side. Your post-auricle nodes. You have your occipital nodes on the base of your head. We have your tonsillary nodes here. These are your mandibular nodes here, and your submental node here, nodes here. You have your cervical, your post-cervical, your deep cervical. Can you pull your shoulders up and forward a little bit? I'm going to look at your subclavicular nodes, which I can't actually palpate those. While I have you with your shoulders here, can you do a shoulder shrug for me? Okay. And now I'm going to put resistance to that. Okay. Very good. Next, if I can have your hand, I'm going to feel your axillary nodes. Sorry if that tickles. And your epitrochial nodes. And while I have your hand, look at your hands, your fingers, capillary refill. Okay, and let's do the same on the other side. Hold your hand up here. Okay, your epitrochial on this side. Okay, I'm looking at the skin, the whole arm, the hands, fingers, capillary refill. And let me test for clubbing. You can hold your fingers like this for me. I just want to see the angle, and there's no clubbing there. Okay, excellent. So, excuse me, can you take your shirt off for me? All right. So what I have you do is turn your head to the left and right. Okay. Now I'm going to have you turn your head again. I'm going to apply a little resistance here. A little bit there. Let's try it again there. Okay. Okay. And now turn your head the other way and let me just a little resistance. Okay. Excellent. I'm looking here for jugular vein distension, and I don't see any. So the next thing that I'm going to do is let me grab my stethoscope. Going to listen for your carotid arteries and also your thyroid. So I'm going to ask you to hold your breath. Go ahead and hold your breath. Okay. You can take a deep breath again and then hold it. Okay, you can let your air out and hold it again. I'm listening to the thyroid as well for any bruise. Okay. And then I'm going to ask you to, I'm going to look at your trachea, ask you to swallow for me to see if it's in or not. Okay. Excellent. That sounds good. All right. The next thing I'd like you to do is turn to the side for me. And I'm going to do what's called costovertebral. This is the angle of your vertebrae and your 12th rib. And you let me know if you feel any tenderness.
No tenderness.
Okay, so that's testing for kidney pain. Is one of the things we want to do to make sure that your kidneys are not hiding any hurt under there. The next thing I'm going to do is called tactile fremitus. If you can say 99 for me.
99. 99. 99.
Okay. And I'm just listening, feeling for that vibration.
99. 99.
Okay. Very good. The next thing I'm going to do is percuss your thoracic area. So I'm going to start in the back, and I'm going to go ahead and percuss your whole thoracic, the back, the sides, and the front. Just start like this. start on this side. Can you put your arms forward for me? Thank you. Okay. Listening for dull areas, resonance, and tympani. I do this thing in the anterior portion. Okay. The next thing I'm going to do is auscultate the same area, thoracic area. Let's use the same pattern. You can breathe normally. Okay, just continue to breathe. Okay, we're going to go ahead and do the front anterior thoracic area. Okay, and your lung fields are clear in all areas and they're absent of bronchi, wheezing, or crackling. The next thing that I'm going to do is diaphragmatic excursion, and that's going to test the expansion of your lungs and your diaphragm. And so what I'm going to do is I'm going to start on the left-hand side and ask you to take a deep breath and hold it for me. And then I'm going to mark the spot. So let me just get a few extra pieces of this tape ready for you so that I can mark it without any delay. All right. One more little piece ought to do it. Okay, so let it all, take a deep breath and hold it for me. Okay, and that's the first area of change. Dull, I should say. And I'm going to go let all your air out and then hold it again with all your air in. And I'm going to go up from that area until I hear the change again. There we go. Okay, and then we're going to do the same on the other side. You're going to let all your air. Okay, and you're holding your breath. Perfect. Okay, that's right there where the change started. Okay, and I'm going to go let all your air out. Take a deep breath and let all your air out again so that it's empty. And wanting to do this with now your lungs are empty. Okay. Okay, and now I'm going to measure that, and it should be between 3 and 5 centimeters. And there we go. That is 5 centimeters on your left and just about 5 centimeters again on your right. So those are within normal limits. Okay, the next thing that I'm going to have you do is lay back on the table here. And I am going to just do general inspection of the of your chest area, and then you're comfortable there, and then I'm going to palpate. So right now I am just palpating, finding your sternum and looking for the sternal borders. So here on the right side, on your second intercostal space here, that's where I'm going to listen to your aortic valve. Let me palpate here, the second intercostal space on your left-hand side. That's where I'm going to be listening to your pulmonic valve. And then we have Erb's point, and your tricuspid. And then on the fifth intercostal space at your mid-clavicular line is your mitral valve. And that's also your maximum, your BMI. So that's what I'll listen to your mitral valve at. So I'm going to listen to those areas if you can hold your breath while I listen to them. And what we can do is you just let me know, kind of oxygenate yourself, and then you tell me when you're ready. All right. Okay, just take a deep breath and hold your breath for me. Okay, I'm listening to your heart sounds, S1, S2. Next thing that I'm going to do is go ahead and palpate your abdominal muscles. And I'm going to listen for vowel sounds. Should have vowel sounds in all four quadrants. Okay, and you do. Next thing that I'm going to do is listen to your arteries. First area right here is your aorta. And the next are your renal arteries. And your iliac arteries. And the next, using your hips as the landmark here, are your inguinal arteries. Okay. The next thing that I'm going to do is find your liver borders, the lower border and upper border, and I had some tape measuring over there. Is it still next to you? I don't know what we did, so I'll just get a few real quick. So what I'm going to do is start on the lower part. I'm going to start at the midclavicular line, and I'm going to percuss below your umbilicus to find the lower border here. When it turns to dull, right there, that's my first mark. And then I'm going to start from above and go down and listen as well. Okay. And that's the upper border, and I'm going to use the same to measure it. And your liver should be close to 12 centimeters. Looks like it's about 11.5 centimeters. So that's within normal limits. And I'm going to go on the other side and do the process for your spleen, your splenic do that as well. It's the same kind of process. I'm going to start below the umbilicus and go up, and percuss up until I hear dull right there. That's the first mark. And start from the top and work my way down. Right there. And that's the upper border. And let's measure that as well. And that is just about 6 centimeters. And that's within normal limits as well. Next thing I'm going to do is try to palpate your kidneys. So what I'd like you to do is just take a deep breath and slowly let your air out. Okay, just barely feel that. Do the same on the other side, and if I was successful in feeling it, it should be firm and non-tender. Let's do the same again. Take a real deep breath and let your air out. And I should be able to feel it slide between my fingers there a little bit. Okay. Alright, and I couldn't feel it on that side either. So the next thing that I'm going to do is look at your pulses. So I'm going to check your brachial pulses here, and radial. Okay, and your popliteal. Sometimes they're hard to feel. It's a little deeper tissue, muscle, I should say, in there. Okay, let that one relax. Okay, and your, let's see, your tibial and your dorsus pedialis. Okay, and I'm going to use a reflex hammer. If you can sit up, and do check your brachial. If you can just let that hang, relax. Okay, and let's do this side. Okay, good. Do your knee. Alright, that's not bad. Do that one more time. Okay, and do your Achilles tendon. Okay, and let's have you push, try to straighten your leg. Okay, and now let's straighten your leg and have you try to bend it. Okay, and let's do the same here. Let's bend it. Now try to straighten your leg. Okay, let's straighten it and have you try to bend it. Okay, let's do the same with your foot. It's bent, and try to straighten it. Okay, now straighten it and try to pull it up. Okay, let's do the same here. And try to straighten it. Okay. Alright, and if you can stand up, if you're going to bend over, kind of don't get your head there, bend over, I'm going to check your cervical and lumbar spine, making sure they're in line, and they are. Okay, you can stand up. Okay, and this ends the video.